We're back to Daybreak this morning. Most businesses in Michigan will reopen tomorrow with no appointment required. And next week, we'll be able to eat at restaurants again, too.
As you and your family start to have more small get-togethers, doctors have advice on how to make these interactions safe, especially for the people in your life who are more vulnerable to COVID-19.
I can't get sick. I have 2 little kids that depend on me.
Come here, bud. Annie Young is a grandmom who works and takes care of her grandchildren full-time.
I have a blood liver disease, and that puts me at a much higher risk than somebody that's normally at my age.
That's something she worries about constantly. As the state reopens, more people are getting together. Dr. Liam Sullivan with Spectrum Health says that doesn't mean life should be back to, quote, normal.
I think you have to ask yourself several questions. Number one is like, how are you feeling? Okay. Obviously, if you don't feel well at all, it is not a good idea to be around them at all.
He says when you're dealing with grandparents or other high-risk family members, continue to keep your distance. Stay 6 to 10 feet away, wash your hands well, and wear a face mask, especially if you need to be in close proximity. If you work in healthcare or another job where you have regular contact with people, video visits are still best. Even if you don't, he says keep the contact to a minimum with everyone.
I would probably avoid close touching, hugging, kissing, etc. As hard as that may be right now.
As far as kids playing with the neighbors,
When they have a kid and they come out and the kids play on the swings together, and it makes me a bit nervous.
Dr. Sullivan says it may be impossible to keep them apart.
Limit their circle as much as you can, if it's at all possible. Try to get them to wash their hands good when they come in the house after they've been interacting with their friends. And that's probably about the best you can do.
As a caretaker, Annie is doing the best she can to limit her grandkids' interactions for the good of all of them.
There's no room for the coronavirus in our life. If something were to happen to me, I don't know what would happen to them.
And the million-dollar question, Casey, is when will it be safe to hug and kiss and be human? Dr. Sullivan says only when we have a vaccine or herd immunity can we talk about going back to that kind of normal, and neither of those things is going to happen for at least 4 or 5 months.
Right, and you think about, Teresa, I mean, we've been under this stay home, this social distancing for, what, nearly 3 months now? It's so easy to fall back into old habits and routines when it's all said and done.
Yeah, and he said you just have to consider the consequences of that as a reminder for why we're doing this.